Chris, welcome to the show and thank you for being here.
Thank you, Dave. Good to be here.
Absolutely. It's an honor to have you on the show today. This conversation isn't just important, it's necessary. Veterans and first responders are battling silent wars every day. And I know that we're about to get into something that could be life-changing for someone listening right now. Let me do a quick intro on you real quick here, Chris, and let you elaborate a little bit more if you don't mind. I'm not going to read all of this, but let's do a little bit here. So bear with me one second here. Welcome to the podcast. Today we're joined by a powerhouse in the world of psychology and mental health, Dr. Chris Frueh. He's a clinical psychologist, professor, researcher, and one of the most respected voices when it comes to trauma, PTSD, and psychological toll on warriors. His work with special operations, veterans, and first responders is unmatched, and he's not afraid to challenge the system when it comes to doing what is right for those who serve. Chris is also the author of Operator Syndrome, which provides a roadmap to understanding the complex effects of every biological system in the body, as well as the social system of family, work, and the indifferent society these warriors return to. He explains how modern healthcare systems, especially VA, have often relied on PTSD easy button and failed a generation of men and women who have carried the brunt in the fight since 9/11 or 9/11, excuse me. And Chris, did I miss anything on your intro that you'd like to add?
No, that's good. That's great, Dave.
All
Thanks.
right, thank you. Thank you. And then thank you for Fred Galvin for the introduction as well. Let's get started. Can you give us a snapshot on your background and what inspired you to pursue this path in psychology and trauma?
Yeah, right on. So I was born in 1963, and my father was a physician who commissioned in the Air Force. So as a very small child in the late 1960s, my father deployed as a flight surgeon to Vietnam, and then in the years after that, really grew up in the shadow of the Vietnam War and what that meant for men and women who fought it. My father was talked about, what he saw and how it affected soldiers. Also in my childhood, maybe I would say my hero up until my age 14 was my great grandfather who died at the age of 99 when I was
Oh, wow.
14.
Okay.
He had fought at the Battle of San Juan Hill in the Spanish-American War of 1898. And so as a child, I would talk with him about his experiences. His story was a very powerful story for me, and including his homecoming. If you don't mind, I'd like to just say a
No, I
word
love
about
it. Yeah. Yeah,
the
definitely.
homecoming.
Yeah,
So
absolutely.
his homecoming at the end of this war, which was a pretty brief war, three months or so, the soldiers came home from Cuba, as thousands of them, and they were essentially dumped at the northern tip of Long Island into a camp that had just been quickly built to receive them. It was essentially muddy fields with rows of tents.
Yep.
And the soldiers coming back from Cuba, most of them had mosquito-borne illnesses from
Oh,
being in
wow.
the tropics. So dysentery, malaria, whatever. And so the camp was a mess. It was not a medically hygienic place, and it became a national scandal, actually. President Garfield went up to take a look at it. And so this is 1898. There's not much of a VA in existence to do anything. Citizens took over. My grandfather, to the end of his life, credited Mrs. Jack R. Bean with saving his life. Mrs. Bean was a citizen from New York City, a wealthy woman who went up to the tip of Long Island with her butler and a horse-drawn carriage and brought 5 or 6 men home with her to her home, brought them out of that nasty, dirty, smelly, filthy camp and brought them to her home and nursed them back to health over the
Wow.
course of weeks, a couple of months even, and then gave them train fare to get home. So my great grandfather was able to get home to Michigan.
Wow.
And as a child, that message really resonated through into my adult years. The idea that the men and women who serve and protect us, that we owe them a debt, that they're affected by their service, and we, the civilians, we owe them a debt that we should be that we need to repay. And the VA, modern VA, is part of that, but it should only be it can only be a small part. So I went to graduate, now back to my story. I went to graduate school in clinical psychology, started in 1987, and my goal was to work with veterans.
Okay.
I graduated in 1992. My first job was the VA Medical Center in Charleston, South Carolina, and with an appointment at the the Medical University of South Carolina. Um, I was a full-time clinician for 7 years at the VA in a PTSD clinic, and then I applied for and started receiving federal research grants from NIH, and then later DoD and VA. So my career turned into a research career studying veterans and other groups affected by trauma, affected by adversity. Um, and at that point, my career kind of diverged a little bit more into research. I continued to be an active therapist for about 25% of my time for another 8 years. Left VA in 2006, moved to the University of Hawaii. I'm here at the branch campus on the Big Island, 19 years running.
Wow.
But for 12 of those years, I had work in Houston. So I commuted monthly between Hawaii and Houston. In Houston, I had initially a full-time tenured faculty position at Baylor College of Medicine, and then that turned into a part-time job where I as research director at the Menninger Clinic. So I was there every month directing research programs. And then the University of Texas recruited me for a couple of years to set up and create a center for veterans mental health and research, treatment and research. And that's where maybe things that we're talking about today began to happen. So about 12, 13 years ago, I was invited to essentially just kind of sit at the table with a small nonprofit foundation in Houston called the Quick Reaction Foundation. It had been set up by former naval officer and a former Navy SEAL who had recently left the teams. He'd been at Development Group, the Tier 1 unit, and he'd been on a lot of the very famous missions that movies have been made about. And so sort of became friends, casual friends at first, and then came to realize that a lot of these guys were really struggling.
Yeah.
And the community that this foundation served was not specific to SEALs. There were Green Berets, there were Delta operators, there were some intelligence, three-letter agency, paramilitary officers who had been part of the Bin Laden task force. There were some folks from Air Force and Marines. So it was a very heterogeneous group of former military special operators. And I think this is an important part of the story. Um, Forgive me for just rambling on like this without taking a breath,
No,
but
you're fine. We
uh,
want we want to get the information out there, so go for it, Chris.
one of the things that happened very early on in these conversations that I was having with these guys. I mean, I was going to like happy hours. I was going to, pizza get-togethers. These were not like fancy formal things. These were just really kind of, opportunities just to have a lot of free-flowing conversations. And several of the guys started sharing with me that they weren't doing well. And this is the typical complaint that I was hearing early on and still continue to hear. Something's wrong with me. I don't feel right. I'm not functioning like I did just a few years ago when I was in uniform. I don't know what's wrong with me. I don't understand it. It doesn't make sense. I've talked to doctors and they can't figure it out either. So I assumed early on, as probably any psychologist, even through today, any mental health professional, that, oh, okay, your problem, it must be post-traumatic stress disorder. I'm an expert in that. I got you, brother. So I'm going to help these guys. Very early, very quickly, came to realize they didn't have PTSD. That was not the problem.
Right.
They didn't have the fear reactivity. They didn't have the avoidance of military cues. Um, yeah, there were some nightmares in their lives, but that wasn't the thing that was crushing them. That was something that occasional nightmares didn't really haunt them. Um, so it became a kind of a gradual process of trial and error of trying to do, we just started getting different tests done to see what was going on. Um, the first thing that we did was I was able to get them into the Brain Neuroimaging Center at Baylor College of Medicine, where I was taking my research subjects through,
Okay.
and we just replicated that paradigm, the protocol, the fMRI protocol we were using, and then I took the brain scans on a disc and sat down with a friend of mine who was a neurologist, and we looked at them together. And what he said was, these brain scans look like the brain scans of 80-year-old men,
Hmm.
85-year-old men.
Wow.
We weren't seeing any kind of gross injuries. It was subtle. There weren't what lesions, there weren't tumors, there weren't big gaps or white spaces. What the neurologist pointed out to me, or what he was able to interpret, was the atrophy in the ventricles,
Interesting.
which happens naturally with age. But here, these were super aged ventricles that we were
Wow.
looking at for
Holy cow.
37-year-old men.
Okay.
And and then the next test, did metabolic and hormone testing, and the hormone panels came back with a shocker. These guys, every single one of them had low testosterone. And I'm talking about men who are in their late 30s, early 40s, and they have low testosterone. The testosterone matched the brains.
Hmm.
They had the brains and the low testosterone of an 80-year-old man.
Wow.
Then sleep studies. And one of the things, I mean, you could talk to them and learn they all had insomnia. But on the sleep studies, what we learned was they all also had sleep apnea, which wasn't expected. They were not middle-aged, overweight men. They were healthy looking, physically fit men with sleep apnea.
Wow.
And so that didn't quite make sense. So, and then of course, there were some other things, chronic pain, joint pain, um, traumatic brain injuries clearly became something that we came to identify. So over time, as these guys started to get better, as we started to figure out solutions for them, help them sleep better, help get their testosterone regulated and into a healthy range, help them manage the chronic pain, the chronic headaches, um, the moral injury, the existential issues are there. And that's not exactly the same thing as PTSD. It's not the same thing as a psychiatric disorder. But it's real, the existential issues of things that happened, things that could have happened, things that we didn't do, that we could have done. And then, a big part of that is the sense of disappointment, maybe even betrayal by the nation, by the politicians, by the generals who led the war efforts. And so, as my small group of guys, at first there were four of them, started to feel better. Other guys in the group started talking with me, and then they were sending their friends my way. So it kind of was what we would call a snowball effect of just purely by word of mouth. Within a couple of years, I was talking with dozens of guys and coaching them off the record, unofficially, not keeping medical records. I
Okay.
wasn't billing anybody for this work. And so I actually became a safe person to talk to as well, because I wasn't part of a chain of command. I didn't work in the VA. I wasn't in the DoD.
Not going to affect the record or anything. Yeah.
Not going to
Yeah.
affect their record, so they could tell me anything. And I started getting to know the guys, and over the years, if we fast forward through today, I've probably worked individually with over 300 operators. I'm going to include in what I call operators, not just SEALs, Green Berets, pararescuemen, Marine Raiders, combat controllers, but also paramilitary out of the three-letter agencies, a few explosive ordnance disposal technicians who work with the soft community, and many of them are very, if they're not operators directly, they're certainly operator adjacent.
Right.
Um, Swick boat operators, the
Yep.
guys that drive the fast boats, some aviators, and um, then, so worked with about 300, 350 of those guys to date. And then also, and most of that was, that was all virtually, well, literally all of that was pro bono. But then I also got picked up for some work by a law firm that was working with private defense contractors.
Okay.
So to date, I've evaluated and coached probably about 300 private defense contractors, um, most of whom were trigger pullers, were shooters,
Okay.
but not all. Some of them were, small minority were things like HVAC technicians, mechanics, HR, logistics, and a slightly larger group of defense contractors. I probably worked with about 50 or 60 interpreters from Iraq or Afghanistan.
Wow.
Um,
That's an
and,
amazing service. Holy cow.
and many of them, I'd say about half of them were already in the US, and then about half of them were still in their home countries when I was working with them, including I was working with about four Afghanis in the 2 months prior to our pull out in August of 2021. So I got an interesting remote bird's eye view of that. And then after we pulled out of Afghanistan, I found I was working with some of our private defense contractors who were there on the ground on those days and
Okay.
in those experiences.
Like we were
Um,
talking right before we started, we're a little bit older and we have a lot more experience, right? So I think going to the people that have the right answers or more answers, right? Because a lot of people just go to the VA, they go talk to the clinician that's brand new, doesn't have any experience, and they're going to give them just medication, right? Just going to give them pop pills. And uh, to date, I don't know if you have or not, but I haven't met too many people that medication has changed their lives, right? I have met a lot of other people, including people that I've had on the show, that go through other therapies that have been able to help
yeah.
them. So I think it's a great resource to get Chris's book. And how do you work with people, Chris? They reach out to you, or how's that work?
Well, so I'm a psychologist. I
Okay.
spent many years as a therapist working within the VA. I spent 15 years working within the VA. I left VA in 2006, so my VA is not experience isn't recent. But here's the problem, and it's not just the problem that within the VA. It's the problem that first responders face when they go to therapists. It's the problem that maybe all of us face if we have mental health problems. And I'm not going to completely bash mental health treatment, but there are two issues that we all need to be mindful of. Psychiatric medications are not miracle cures. We use them constantly. I mean, if for anybody diagnosed with PTSD, they're almost certainly going to be prescribed antidepressant medications at least. And then that can turn into a slippery slope. So I often see veterans on 10, 15, even 20 different medications through the VA.
My
It could
gosh.
start, it could start
Talk
with
about side
a
effects. Holy cow. Just with
yeah.
one, you got plenty of side effects. Go
With
ahead.
ones. So here's kind of the slippery slope of what often happens. One antidepressant, 2 weeks later, it's not enough. So a second antidepressant, maybe a sleeping medication added. Later, maybe a medication to treat nightmares. Now,
Mhm.
mind you, none of these medications are miracle cures. They might
Right.
give somebody a 10 to 20% benefit. They might not give any benefit, and the side effects may far outweigh whatever clinical benefits there might be.
Yeah, I consider
Then,
I consider it more like a Band-Aid, right? It's like here you go, kind of like what you said, the easy button for the term PTSD. The easy button, just give them
100%,
these pills, and
right.
let's see what happens, right?
The diagnosis is an easy button, and the treatment becomes an easy button.
Which is terrible because what are we seeing with that easy button? Terrible results, right?
Terrible.
Death, including death, which is terrible. Go ahead, Chris.
Yeah, yeah, right. And then the therapy is the other piece of it, psychotherapy. And the problem with psychotherapy is most psychotherapists are, or I'll flip this around, very few psychotherapists are trained to be culturally competent and aware and educated to work with first responders and soldiers. very few therapists. Um, with the exception of those who either put on the uniform or who have been in the service in some capacity, or maybe have a spouse. You have a lot of spouses of soldiers who do therapy. And it can be hard, very, very hard to find a therapist who's competent to understand and work with specific population of high-risk professionals, in part because of their biases and assumptions of PTSD, but for many other reasons as well.
I think another reason or another challenge that they have is they have to work within a certain box, right? Their own framework, and it's pretty limited,
It's pretty
right?
limited,
It's
right?
like what options do I have? Can they talk
That,
about other therapies? Can they talk about anything? It's probably not, right?
well, they can,
Oh,
and
can they talk to them? Okay.
that they can, and that's where things kind of can get interesting. But part of the challenge is they don't necessarily know about the other therapies.
Very good.
You could ask a
Yeah.
room full of psychologists who's heard of stellate ganglion block therapy, and only a couple of hands are likely to go up. And
Wow.
when you ask them if they ever use it or refer to it, the answer to that is probably going to be no. So, and we can come, we should get and talk about some of these therapies here in just a moment. But
Yes, absolutely.
one other thing I want to say is the other thing that happens with this, and this is not a hyperbole or exaggeration when I say this. Many soldiers, many first responders go to see a therapist and get into the early stages of talking about their things that they've seen, things that they've experienced, been a part of, and even just scratching the surface, the therapist becomes a little bit overwhelmed. The
Okay. Got
therapist
it.
becomes
Too much for them.
emotionally
Right.
distressed
Yep.
by what they're hearing. And then the patient gets up and walks out or doesn't come back for and certainly doesn't come back for another appointment. And would you believe I hear this everywhere I go?
Yes.
This is not a rare occurrence. This is very common. And there is a great solution right now developing. It's called the Soft Network. The Soft Network is a foundation, nonprofit foundation, started by a psychologist named Chris Ostrander. And essentially what it is it's a registry of therapists around the nation who have signed into this thing and have gone through some vetting to be culturally competent to work with high-risk professionals.
Oh, wow. That's awesome.
So if you're a first responder, if you're a veteran, if you're a soldier, if you're a spouse, and you want to find a therapist who would be attuned to you, go to the Soft Network. They have a registry. So if you live in Iowa, you can go and see who are the therapists in Iowa who might be available to and
That's great
qualified to work with.
resources. I think a lot of people that go in that I've talked to, it's like, Dave, I just went there to waste my time. The
Yeah.
person wasn't competent, didn't help
Yep.
me one bit. So you have to be your own advocate for your own health, right?
You really do. You
Because
really do.
nobody else is gonna know you, right? It's like, what are you feeling, right? And there's a lot of
Yeah.
different therapies. The soft community you were talking about. Fred has their Hooks of Hope as well, right? That's in
Hmm.
Florida, so that's
Yep.
another one. I think it's hooksofhope.org, I believe it is. So,
Uh, Hooks of Hope.
oh, look at that. Awesome.
I've done a few presentations to at their retreats and such, so I have some of their hats and t-shirts that they've
Awesome.
graciously sent my
And they
way.
have some therapies and help as well, right?
Yep, yep,
Okay.
yep. And that's where a lot of operators are finding help. They're finding it through the benevolent associations and the foundations that have been set up, essentially out of frustration with what DoD and VA are providing in terms of care. And so I'll give a shout out to the Seal Future Foundation is the foundation I've worked with most closely.
Okay.
I've helped develop their health program. I've helped I meet with them standing meetings every week, and I chair their or a board of medical advisors.
Oh, wow.
That's a multidisciplinary group. There's about 12 of us with all kinds of different degrees. We meet every other month. And the guy that set that up, a young man, a young SEAL named Joey Fio, And he's kind of a genius at what he's built and done. And so I support him. This is their program. I'll describe it very briefly.
Okay.
Any SEAL can call, well, it's retired SEALs or separated SEALs who's having trouble, call the number, talk to, and you're going to talk to another SEAL. You're not
Nice.
going to talk to me. You're going to talk to another SEAL. And those SEALs have probably been medics in the past. They were probably combat medics. And they're using the operator syndrome framework. And they then they don't prescribe, they don't tell somebody what they must do. They're not providing medical services. But what they do is they listen, they coach, they provide ideas, information, and then they'll help help the SEAL kind of identify what kind of interventions might be helpful for them. And then they will not only pay for it, but we've got a large referral network of where to get the different kinds of services around the country. And they make sure that happens. This happened a couple weeks ago. There was a guy, a SEAL in one city who was at a real deep crisis. He was suicidal. One of the SEALs from the SEAL Future Foundation actually flew across the country on a moment's notice to meet him, met with his wife, spent the weekend with him, then flew with him to Kansas City to a regenerative medicine clinic that we often refer to there, and spent several days getting him set up there and with
Wow.
treatments. And
Yeah.
so that's the extent to which they'll go
We'll
to.
definitely have to put those links on the podcast, Chris,
Yeah,
so people get a hold of these
yeah,
guys because there's
yeah.
definitely a lot of resources, but a lot of people don't know how to find it unless they talk to maybe some of their other,
Right, right.
people that they've worked
And
with.
and if I may, there's one other service in full disclosure, I have a very small part-time job with this group. They're called
Okay.
Sharp Performance, but their model, what they are providing is it's former SOF operators who work for Sharp, who set it up, who created it, who've developed it. And what they're providing is one-on-one coaching to first responders,
Okay.
active first responders. And they sell subscriptions to departments. So like a police department, a fire department can sign up, and what they're going to get is it's going to be a SEAL, it's going to be a MARSOC Raider, it's going to be an 18 Delta,
Oh,
it's going to
wow.
be
Okay.
another operator who becomes the coach for that police or that firefighter. They're using the operator syndrome framework, but they're also using their own lived experience, their own things that they found useful from their own health journey. And of course, they carry, gravitas and they command respect from the first responder community. So it's developed into a really good solution, potential solution for first responders as
Wow.
well.
Okay. That's awesome. Glad to hear that. Well, we're talking about therapies. Uh, what's some of the top therapies, or can you go a little bit more detail on some of these therapies that are available?
Yeah,
So
yeah,
people
absolutely.
are aware of them, and I know you mentioned a few of them, but let's dive deep into those if you can.
Yeah. First, let me first just say a few words about operator syndrome and kind of how to understand it.
Yeah,
It's
absolutely.
not a diagnosis, it's a framework. And the premise of the framework is that high-risk professionals in the course of their work, whether that's soldiering in the combat arms, whether that's first responding, that they inherently are going to endure and receive a massive physiological impact on all of their physiological systems in their body. And we call this allostatic load. Allostatic load is a medical concept, a physiological concept. It's not something that's it's not specific, but what it is, it's a way of thinking about all of the different vectors that affect the body. So when we think of operators, that's repeated blast exposures over and over and over again. That's the high operational tempo, always going, always going, always going. So the cortisol and stress hormones are always elevated. It's the sleep deprivation. It's the circadian disruption that occurs. It's the physicality of the work, that leads to chronic joint pain, headaches. Um, then there are psychological issues that occur. Depression, anxiety, anger are probably the most common.
Okay.
Alcohol
Yep.
abuse is up there. We also see massive impairments to Perceptual systems, so vision and hearing are impaired. Balance, a TBI, a traumatic brain injury, leads to either mild, can even be severe symptoms of vertigo. So nauseousness combined with unsteadiness or dizziness. Then all of that, as you said in your opener, cascades into the social world. So you
Mhm.
take all of that and it's going to affect your marriage. It's going to affect your parenting. It's going to have effects on your work, your ability to perform in your work. And especially after service, especially outside of your employment work, your service work, your ability to interact with other people is affected. Your emotions are affected. And we talk about existential concerns. So that could be moral injury, it could be survivor's guilt, it could be a profound changes in how one views one's faith, one's view of humanity. Moral injury often involves a sense of betrayal by the government, by society, by generals, politicians, etc. That's often a piece of this. And of
I love
course,
that.
all of
It's not just one thing, which is
it's not just one thing.
right.
It's a whole bunch of things. And at the very far extreme end, we see suicides,
Right,
and
exactly.
the suicide rate for military special operations and first responders is very high. It's very high, and that's always in the back of our minds. So we're talking about a very physiologic collection of injuries that are mostly going ignored.
Yeah.
The medical system is set up to go, okay, that's PTSD. Oh, trauma equals PTSD. And then we stop, we give psychiatric medications, we give psychotherapy, but we're not treating hormones. We're not addressing the sleep very effectively, which doesn't necessarily mean we need medications. We're not addressing the chronic pain that these folks experience. In fact, they live with the chronic pain and they just start to ignore it and brush it off as just it's normal. They don't even talk about it.
Yeah.
Um, and then a lot of the therapy that could be useful, could be helpful, is oftentimes not, as we talked earlier, it's just not, doesn't resonate. It doesn't reach. It's not relatable to the guys. And all of this affects both health, but it also affects performance on
Hmm.
the job. It affects performance in private life, personal life. So the way I kind of frame all of this is that the operator syndrome is about improving performance and career longevity on the job. It's also about improving health and quality of life for the long haul. Okay, so treatments. Dive into that.
Yeah, I just wanted to say real quick that, we've talked about being, advocate for yourself. And I think some of the points that you were talking about, there is a variety of things that you need to make sure that you're watching in your body, right? You need to physically, mentally, spiritually, you need to make sure you're balancing all three of those. If not, it's kind of like running a car with three tires instead of four tires, right? So you need to make sure that you're taking a look at everything within your body and make sure well, I was telling Chris earlier, I've been eating really healthy for the last, months, and I just ate, pizza and a burger, and I felt like crap basically that very afternoon. So if you're feeding yourself junk, if you're getting, you're drinking alcohol every day, what's going to happen to your body? It's not going to respond properly. But let's
Hey,
dive
you're
in.
not going right. You're not going to be doing well at all. And to your point about being an advocate for your own health, that is super important because the healthcare system has some real significant limitations, and it helps to be aware of those. So those include that PTSD is the easy button, that mental health care has these blind spots.
Yes.
We don't think about hormones. Mental health providers do not do anything with hormones. I've been in 3 psychiatric departments over the last 30 years as
Okay.
faculty. Large
It's just not being
departments.
taught, right, Chris?
It's not being taught.
Right.
It's not being used. Um, I never had a colleague in any of the psychiatric departments I was a faculty member in who was a urologist or an endocrinologist. Just
Wow.
didn't. We had geneticists.
Right.
We had neuroimagers. We had internal medicine specialists, never somebody who focused on hormones. And
Why,
guess
why do you
what?
think that is?
Ignorance, biases,
Okay. Yeah.
tradition.
Yeah.
We're still very much locked into, although most psychologists, most therapists would deny this, we're still very much locked into the Freudian concept
Yeah.
of mental illness, and that
Yeah.
it's a thing that occurs in the head, in the subconscious, that it's all about, and on the behavioral side, it's about conditioning and it's about the way we think about things. And not that any of that is necessarily completely wrong, but it's insufficient.
But look at the track record, right?
And look at the track record. The VA can show no evidence that veterans are getting better. There's zero administrative data, and the suicide rate has not changed. It keeps going up. It has changed. It keeps going up. It's not
Oh,
coming
that's good.
down.
Yeah.
So for all the money the VA spends, last year they had 2 years ago, last year, I don't remember whether it was 23 or 24, they spent 500 plus $1 million specifically on suicide prevention, and the rate only went up from there.
You know what blows
So
my mind, Chris? It's like they hear all this from everyone, and a lot of guys still get, they're getting out, uh, drink a lot, right? And they tell them don't drink when you're taking these medications, right? And what do the veterans do? They don't listen, right? We're hard-headed, right? Think what we want. And it's like, wait a minute, you're giving them something that's going to make them worse and possibly kill themselves, right? It's like it's common sense. It's like, we can't be doing this, right? It's like, especially when you just mentioned that they don't have any track records of it getting better, which is pretty interesting.
well, and let's put the hormonal concern into context.
Yeah,
For a 35-year-old man with low testosterone, how is he going to look? How is he going to manifest? And this is how. He's going to appear to be super depressed.
right.
He's going to have low energy, low motivation. He's going to be irritable. He can't concentrate. He's got insomnia. He doesn't want to work out. He's feeling apathetic. People who know him are wondering what's wrong with this guy. He's not himself. Yes, his libido and his erectile functioning are going to be disturbed. He's going to look in the mirror and just go, "What the heck is going on with me?" And then he's going to go see a doctor who's going to tell him he's depressed, and then he's got psychiatric antidepressant medications and psychotherapy, and nobody has looked at his hormones. And so this is those guys I started with. Once we got them treated for hormones, which it's for some was testosterone replacement therapy, for others it was something like Clomid or something more, more short-term medication. For others, it's diet and supplements and things. But once their testosterone goes from 150 up into the normal good range of 600, 700, you're looking at a different guy. That man is now very different. He doesn't look depressed anymore. So that prescription of Prozac isn't going to address the root cause of the problem. We're
Right.
just ignoring it. And that's part of the tragedy here is we have the treatments, we have the interventions to do right by our warriors. We're just not providing them. And so
100%.
so part of the problem, part of the reasons we're not providing them is ignorance, blind spots, bias. Part of it is that healthcare is so fragmented by specialties. So even if you do get to a sleep specialist, that sleep specialist is unlikely to look at the patient's overall picture. They're unlikely to say, these medications are the reason you're not sleeping better, or it's your hormones are maybe a reason you're not sleeping better.
Yeah. And
We also have a lack of, I'm sorry.
let's say one thing you got to keep in mind, it's the government, right? The
It's
government doesn't
bureaucracy.
doesn't operate efficiently. It's a big
Yeah.
vehicle to move. And I always tell people, it's like, hey, back when stuff was happening in 2000, it's like, uh, here's a good. I go, do you trust the government? And they go, oh yeah, yeah, we trust the government. I go, all right, grab an envelope, put $500 and send it in the mail. They go, we'll never do that. It's like, I thought you trusted the government, right? So it's like, uh, unfortunately, they don't have all the tools to be able to help you.
Yeah. Yeah. So what do we do about this? So
Right.
So I've done a lot of coaching over the years. I don't do a whole lot of it now or quite as much of it now. But from a coaching perspective, two of the things that I always emphasize are when it comes to what are solutions? One solution falls in a big bucket, and let's call that lifestyle habits. These are things that are on you. These are things you have control of, you can
Mhm.
do for yourself. You don't need a doctor to help you with. And then the other bucket are the interventions.
Right.
And yes, traditional interventions are in there, but so many others are as well. So let's just kind of walk through this. So I'll start with lifestyle habits. I break it down into two pieces. One is sleep. Prioritize sleep. Do everything it takes to improve your sleep.
How
That
many
that
hours
in
do you recommend?
7.5 for most of us.
Okay.
And we want those 7.5 hours to also not have too many interruptions throughout the night. And we want to have adequate time in recovery sleep. So slow wave sleep and REM sleep. We know so much more about sleep than we knew 10 years ago. It's amazing, in fact.
Hmm.
We've discovered a glymphatic system in the brain, for example. While we're in slow wave sleep, that glymphatic system gets activated and it is cleaning out the toxins in the brain.
Wow.
If you don't get enough slow wave sleep, those toxins aren't being cleaned out. You have a dirty mind. Uh, Also, during slow wave sleep is when our body goes into recovery mode. Our immune system is boosted. We're healing. We're recovering. We're fighting off infections. REM sleep is also very important, but for different reasons. That's when our cognitions, our thoughts, our memories from the day are being organized and consolidated. We're solving problems. We're doing important things in our sleep. And if you're not getting enough sleep and not getting the right quality of sleep, you're doing harm to your metabolic functioning. It's harming your metabolic, it's harming your hormonal functioning, it's harming your brain health. So all of the physiological systems are being jacked up even further. Insomnia leads to weight gain because when we get good sleep, that's when our metabolic functioning is regulating. Testosterone is produced while we're sleeping. So if you're not getting enough sleep, for men, they're harming their testosterone
Wow.
production and the regulation of all their hormones.
Wow. It impacts
So
quite a bit.
everything, and it's so, the old Warren Zevon song, I'll sleep when I'm dead, which was
You're gonna get there much quicker. Don't worry.
you're going to get there much quicker. Exactly.
It's like it's like
Exactly.
like it's like you're not charging your battery at night all the way. You're operating
Yeah. Yeah.
inefficiently, right?
Yeah, yeah, yeah. So everything it takes to sleep well, and that means sleep hygiene, the habits. That means going to bed at a regular time and getting up at a regular time, sleeping in a bedroom that's dark, silent, cold, getting early morning sunlight, having no screens, no TV, no alarm clock, or no visible clock in your bedroom, things like that. And if you really put priority on that, and I actually advise people to read a book called 62 Romeo by
Okay.
a former SEAL, Rob Sweetman. Terrific. It's a thin little handbook on how to get better sleep.
Oh, wow.
And it's a great book.
Okay.
There are also online courses you can take on sleep, the sleep basics, the do's and the don'ts. I have a section in my book, Operator Syndrome book, on it. So that's
Okay.
something that you can do. The other piece of lifestyle habits is trying to live an anti-inflammatory lifestyle.
Yes.
Chronic systemic inflammation in our body is a overreaction of an immune response. Our body is trying to reject all the poisonous things we do to our bodies. And this has become a factor in modern life. So it's modern, all the conveniences of modern life actually are slowly degrading our health and killing us. This chronic inflammation is in every cell in our body, including our neurons. So neuroinflammation is part of why brains don't have good health. It's why injured brains struggle to heal themselves. So we want to lower the inflammation in the entire body. And the ways we can do that include eating a clean diet. Get rid of the junk food, the
No
fast
sugar.
food,
Yeah.
the sugar, the soft drinks. Anything that's highly processed is literally poison for our body.
Right. It's amazing all the
Alcohol.
marketing that's out there, though. So many people fall for that, right? It's like, hey,
Oh, I mean,
oh, that's
it's
my
big.
taste buds love it. I think it's good, but
Yeah,
it's
yeah,
like, hey, would you give that food to your dog? Probably not.
yeah. Right, right. That's a good example. That's a good illustration of the problem. Um, Good sleep, moderate exercise are important for managing inflammation. Um, Taking a hot sauna bath. We have randomized controlled trials that 3 hot sauna baths a week for about
Okay,
20 minutes apiece lowers inflammation,
nice.
helps treat helps treat depression. Um, Minimizing alcohol and tobacco, eliminating those. Intermittent fasting. I'm a proponent of a 16 to 8 fasting feeding window. I try to eat within a 6 to 8 hour window myself. Sometimes I only eat one meal a day, and I feel great when I do that.
Oh, wow.
There are supplements you can do. Anything that supplementing with omega-3, vitamin D, turmeric, um, creatine, very good. Creatine, 10 milligrams of creatine a day, very good for the brain. Um, Magnesium, very good for sleep. Um, Also, one of the things that we forget to do is have recovery in our lives.
Hmm.
So too many of us, especially hard charging, high risk professionals, put a lot of emphasis on the hard work, on the training, not enough on the recovery side of the equation. So we all need, and recovery is about more than just sleep. It's about more than just cold plunges and hot sauna. Those are all great, but get a hobby, pray, journal, meditate, yoga, jigsaw puzzles, listening to quiet music, whatever it is, gardening, there's no one size fits all, but having things like that
Having
in
an
your
outlet for
life.
yourself. Yeah,
Yeah,
100%. Yeah.
yeah. And then there are some amazingly powerful treatments that the medical field and providers can offer. And where I would start with that is stellate ganglion block therapy.
Yep.
This is a very effective, very safe, and very immediate clinical intervention. It involves receiving a shot into the stellate ganglion nerve, a shot of medicine. It's an injection. The stellate ganglion nerve is part of our sympathetic nervous system.
Where do they put that shot in, Chris?
So it runs down our spinal column. They put it in around C6, C7.
Okay.
So it's the side of the neck, and
Okay.
usually sometimes it's one side, sometimes dual sided. Um, it's the equivalent, or no, it's not the equivalent. It's very similar to what a dentist does before they work on a tooth. Before they
Got it.
get that drill going, they inject Novocaine into that nerve of that tooth. And the Novocaine is short lasting. Usually it's a longer lasting medication that's used for stellate ganglion block. But the effect it has is within a few hours, it takes the inflammation sorry, within a few hours, what it does is it lowers the physiological arousal in the body. So it is lowering inflammation. It's going to lead to lower cortisol elevations. What most guys describe, and it's literally later that day, that's how fast acting it is they describe feeling more relaxed, less irritable, less angry, more present. They're able to kind of let down their guard a little bit and enjoy being with their families. Um, Spouses often say that they're nicer, more easygoing, maybe more like they used to be, and they sleep better because they're more relaxed. And once you do that, you have that opens the door to a whole lot of good things. Becomes easier to do the other things that
Right,
we want to
exactly. I was gonna
see.
say that's not just a fix all. You still have to put everything in place
It's
and put everything
Yeah,
together, right?
it really just kind of opens
Right.
the door to begin to do other things. Now, the treatment itself typically lasts for somewhere between What I see is typically between 4 and 18 months. So it's
Okay.
doesn't
And
last
The
forever,
VA does
but
not cover that, right?
um, not really.
Okay.
The VA might provide it in some places.
Okay.
Um,
Yeah, I remember
so
hearing something about that. Yeah.
some veterans have been able to get it either in
Okay.
their VA, but that's very rare. Some
Okay.
veterans have asked for it and have worked. You got to be a squeaky wheel, but they've been able to get it through community care and have the VA pay for it.
Got it. Okay.
Um, but let's say this. I think this is important to be mindful of. It's an outpatient procedure. Just takes a few minutes, and it's not a new treatment. This is a
Right.
treatment that's been around since the 1920s.
Oh, wow.
Um, so we know this treatment very well. Now, it's been used historically for treating certain types of headaches. And the way we learned that it also helps with anxiety and physiological arousal is that some of the neurologists, a couple neurologists, Sean Mulvaney and Jim Lynch, an anesthesiologist named Gene Lipoff, friend of mine, all friends of mine,
Okay.
um, at Fort Bragg, they were treating soldiers' headaches. Well, not Lipoff, but Mulvaney and Lynch were treating soldiers' headaches. And then they were coming in, the next week saying that describing this feeling of relaxation, of improved sleep. So they were getting, multiple benefits. And so they were like, huh, that's really interesting. I wonder if this is a real effect. So they then did the randomized controlled trials and demonstrated this effect. So it's a really good treatment for anxiety, for PTSD, for anger, and for just the general physiological arousal that most um, first responders and soldiers experience on a chronic basis.
Wow. That's awesome.
And we now have pretty good evidence to believe that stellate ganglion block also helps stimulate neurogenerativity. So it's going to help the brain actually heal itself.
That's awesome. What's the next one after that?
I like ketamine infusions,
Okay.
and the only service delivery method I recommend is infusions,
Okay.
not nasal sprays, not tablets, nothing you buy on the street, but only done under proper medical supervision in a clinic. And this involves usually 4, 6, maybe 8 sessions,
Okay.
which can be provided. You could do 4 in one week, you could do 8 in a month. You can pack them together in close proximity. And for this treatment, the patient goes in, sits in a very comfortable reclining chair. Usually there's soft music, eye shades, and they spend about an hour with a needle in, receiving a drip of ketamine
Okay.
running into their body. And then after about an hour, hour and a half, the providers remove the needle and they let the patient sit there for another hour, 90 minutes till their head clears, and then they go home and they're done
Wow.
for the
Pretty
day.
simple. Okay.
This is an FDA approved treatment for depression.
Oh, wow. Okay.
But so this is not fringe medicine in the least.
Right.
Um, but it's very hard to receive this care through the VA. The VA doesn't like to provide it. It's rare that they do provide it. Um, it effectively treats depression, anxiety, some of the existential issues. It also stimulates neurogenerativity. So it's also a treatment for traumatic brain injury. And there is a protocol. Gene Lipoff, who's up in Chicago, has developed a protocol where he provides the stellate ganglion block and 4 ketamine infusion
Oh,
treatments
combination.
within 1 week.
I
So
was going
you
to
could
ask
go
you that if there's a way to combine those. So you just
go
okay.
to one of his clinics, and
Okay.
he's part of a franchise now, the Stella Centers. There's about
Okay.
40 of them around the US, but this is not unique to Stella. Many places provide these treatments.
Okay.
And we now believe that stellate ganglion and ketamine together in close proximity actually amplify the benefits of each other.
Wow. That's
So
amazing. Okay.
I'm a fan of that intervention.
Okay.
Another
Is
treatment I
that
like
considered a
is
psychedelic or no?
it is, and
That's
it
what I
is a
thought.
hallucinogen.
Okay.
It's different
Yeah,
though
it's
from some of
different
the
from the
other
other psychedelics. Right.
yeah,
Okay.
which we'll get to here in just a moment.
Okay.
Another treatment I like is vestibular therapy.
Okay.
Vestibular therapy is essentially physical therapy for the inner ear. It doesn't involve any medications or injections. There's nothing invasive about it, but it can be a very effective way of treating dizziness, disequilibrium, vertigo, And it's usually something that somebody does for several weeks and then they're done with it. And hopefully those problems are either lessened
Is there
or
special clinics
removed.
for that, or is that doctors?
There probably are clinics for it.
Okay,
And does the VA offer it? I think a lot of VAs have it. Doesn't mean
okay,
that it's easy to
got it.
receive
Okay,
it. Another treatment, the generic version of it has been around about 10 years, transcranial magnetic stimulation.
interesting. Yeah.
Again, this is FDA approved as a treatment for depression. It involves sitting in a chair for about 20 minutes and receiving, they position a coil of a magnetic, puts little magnetic pulses into one side of the head for about 20 minutes. Kind of tickles. It's not shock. It's not, doesn't hurt. It doesn't have any lasting side effects. It's a very gentle stimulation. Takes about 30 sessions. Now, there are a number of groups around the country who have improved upon this, we think. Um, I just recently published a paper myself a few months ago using an intervention that's known as magnetic electronic resonance therapy, which is a more precise version of transmagnetic stimulation. We use EEG,
Okay.
um, and we take an EEG reading, which then helps us fine tune the frequencies of the vibrations that we're going to use. So MERT is the acronym. MERT is a good treatment. Another one that I think has a lot of promise, hyperbaric oxygen therapy.
Hmm.
Now, that's been tested a little bit for treatment of TBI and PTSD. And in the US, there's like two or three randomized clinical trials that didn't really show conclusive evidence of benefits. However, anecdotally, a lot of veterans have found that it's very effective for treating traumatic brain injuries, that it restores their cognitive functioning, that it improves their headaches, and that it has other systemic benefits, reduces pain, improves their vision, and things like that. Now, I tell you all of that to say this. It's hard to get in the US right now because there's not yet enough randomized controlled trial data to support it. But the Israelis have filled that gap. The Israeli protocol for hyperbaric oxygen therapy now looks really, really good.
Oh, wow.
It's, however, it's expensive and time consuming. The
Okay.
protocol means 60 sessions in a dive tank. Now, you could do 2 sessions a day for 30 days, but that means going somewhere to get that treatment, and
Okay.
that is significant. I do know individuals, some moderately wealthy individuals who have purchased their own hyperbaric oxygen
Yeah.
systems for their house, and they swear by them. They say
Okay.
they're phenomenally helpful, but I'm
Very
not sure
expensive. Yeah.
that's expensive, and I don't know that there's full medical agreement on that.
Got it.
I'm saving psychedelics for last.
I've
Um,
noticed.
uh, if that's okay.
Yeah, no, that's
Um,
good.
Two, speech pathology therapy, another
Interesting.
form of therapy it's done by speech pathologists. It's a form of
Okay.
therapy that helps people with the cognitive impairments. So it's a way of helping people learn how to focus their attention better, stay more organized, and improve their short-term memory. So it's
Okay.
basically tutoring people into how to have learning strategies and use learning approaches. Um, we talked about functional medicine a little bit. Regenerative medicine clinics or functional medicine clinics, I think, are one of the best places to go in terms of they provide a wide range of interventions and they do it really well. And they use a lot of things like stem cells, peptides, exomes, NAD plus infusions. They also commonly provide stellate ganglion blocks and ketamine infusions. So I refer to specific clinics in the Panhandle of Florida. There's a really good one in Kansas City. There's a great one in San Diego, and I'm sure there's many more of them all over the country.
Got it.
And that's approach I look for. The problem there is, again, VA doesn't cover that. Most traditional health insurance doesn't cover that.
Right.
So the guys I know that are getting treatments, they are getting that treatment covered by foundations.
Okay. Gotcha.
Um, Peer coaching programs. I'm a big fan, and we've talked about the problem of therapists who are not attuned to high risk professionals.
Hmm.
There is so much value then in the peer coaching model. And I mentioned SEAL Future Foundation, I mentioned Sharp Performance for first responders. The Boulder Crest program, or the Warrior Path is another name for it. Boulder Crest Foundation, phenomenal intervention that involves a 1 week retreat for soldiers, veterans, first responders. There's no PhDs, there's no MDs involved, there's no master's degrees involved. This is truly pure coaching, but they've got a very structured approach that they use to this. So
Okay.
peer coaching, I think, is going to be something we see more and more of in the future. And the VA is starting to pay for and cover and have peer coaching programs as well.
And you do coaching and speaking as well, right?
I do. I
Okay.
don't. Uh, Sometimes people contact me and say, "Can you be my coach?" And I don't have a practice that I don't. I'm not out there to. I don't have a business model to provide coaching services. The coaching I've done is really has been pro bono, and for many years was just friends of
Friends of
friends,
our
word of
friends, yeah,
mouth.
that I figured, yeah.
And I don't really have capacity to do that
Got it.
myself anymore. But I certainly can point people
Cut your
towards
sleep in half. No, I'm gonna kid.
cut my sleep in half, stop exercising. That would clear up some time. Yeah.
Oh man.
All right. I saved psychedelics for last.
Okay.
So let me start with this. 4 years ago, I would not have talked to you about psychedelics.
Okay.
4 years ago, in fact, Heroic Hearts approached me to be an ambassador, and I was like, "Get the F out of here!
Okay. Gotcha.
Psychedelics,
Right.
those are dangerous. We don't know what they do. I'm not a believer." I've done a full 180. Um, I love what I've seen a lot of these psychedelic foundations do. And I now believe that psychedelics are a powerful intervention for the existential concerns that are prominent, that they are powerful for helping with the psychological issues, including addiction. A lot of people who do an ibogaine journey afterwards stop drinking, not because they're doing some kind of heavy willpower thing to reduce their alcohol. They just lose interest in it,
Wow.
which is beautiful.
Wow.
Um, they also stimulate neurogenerativity. So I think not only are they psychological interventions, but I think they're powerful interventions to improve brain healing. And when you improve brain healing, you're going to have benefits to sleep, to hormones, to cognitive functioning, to headaches, to metabolic functioning. So healing the brain helps heal all of the physiological systems in the body. What do we know and what do we not know about psychedelics? From the medical research right now, if you go in and you do a literature review of everything that's been published, what you will come away with, what I come away with, is that psilocybin looks like it's a very effective treatment
Okay.
for the things we've talked about. And I believe psilocybin is likely to be mainstream with FDA approval probably within the next 3 to 5 years.
Wow.
The research is really good, including randomized controlled trials. Research on the other plant medicines is not at that same level, in part because we haven't focused the research on the others. So most of the medical research has been done with psilocybin.
Is that because they
Now
have
we're
the best effect so far? Is that probably why?
I don't even think that. I think in some ways it's just the most common.
Interesting. Okay.
Maybe it's the easiest to source.
Okay.
A lot of people grow mushrooms in their basements or their closets now.
Right.
It may just have been the one that people had the most awareness of. Uh, Maybe it
But
also
definitely get that through a clinic, right?
that's a really important point. I'm glad you said that. So this is the other side of psychedelics. Some people talk about microdosing. Some people talk about doing psychedelic journeys on their own in their homes. And I'm going to say I'm really not a fan of either one of those.
Right.
I recommend psychedelic journeys that are done through an organized medical program that involves carefully sourced plant medicines not something bought from some shady person in a back alley kind of thing.
Right.
Something where they actually know where it came from, how it's been sourced, and can really be precise with the dosing. You eat a mushroom that you grew in your house, you might feel, you're going to feel it, I guess, but you don't know exactly how much you're getting. And I worry about that. There's also medical risks. So we want a cardiac screening ahead of doing a journey. We want there to be a monitoring of that journey from a medical perspective. We don't want people doing these things unsupervised.
Right. Absolutely.
The other concern about microdosing is what even is that? Everybody who does microdosing has a different definition of what they do. So it's complete Wild West. To
Okay.
say you microdose is to say you're randomly doing something, but it doesn't mean you're doing anything the same way that anybody else is doing it.
Yeah, that's true. Okay.
And I worry about that. And the whole point of psychedelics is they're powerful medicines. Anything that has the power to heal, fentanyl, for example, we use fentanyl medically in surgeries as an anesthetic. Anything with the power to heal also has the power to do harm.
That's true.
So we want to get the healing powers of psychedelics, but not the harm that they potentially can cause.
Right.
Um, what are the psychedelics? So we've talked about ketamine a little bit, psilocybin, ayahuasca. I don't know much about ayahuasca. I don't. It doesn't seem to be as widely used. Um, the 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 plant medicine that I think may go down in the future as being the most powerful is a combination of using ibogaine and 5-MeO-DMT, two different compounds. There are programs that use, so the Mission Within, Vets, Heroic Hearts are some of the foundations that support um, um, high-risk professionals on getting to get these interventions. Um,
So
the
it's
mission with
support by coordinating it or support like paying for it?
both,
Both. Okay.
both,
All right.
both.
Awesome.
And maybe they don't pay for the whole thing. Maybe
Portion
other
of it.
foundation, yeah,
Okay.
maybe they pay for a portion of it. Mission Within, for example, their program is in Rosarito, Mexico, where
Okay.
it's legal. It's legal in Mexico. Martin Polanco, who runs that program, he's an MD, he's a physician, and he for 17 or 18 years ran an ibogaine clinic in Mexico, where he was treating addictions. And about some years ago, 5 years ago, 6 years ago, I don't remember exactly how long, he started working with operators and he set up this program in Rosarito. And the way it works is former operators, first responders, they go to San Diego, fly into San Diego, drive about 20 minutes south to Rosarito. They stay in a house there or a retreat place there that's on the beach. The first night they take ibogaine. The second night they take 5-MeO-DMT. Let me say a little bit more about each of those. Ibogaine is an ass kicker.
Okay.
I hope it's okay to say bad
Wipes
words.
wipes you out.
Wipes you out. Yeah,
Okay.
it can't. It's usually an 8 hour journey
Oh
for some
wow.
guy. Some guys it
Holy
turns into a
cow.
12-hour journey,
Wow.
and it typically involves vomiting and purging. Um, People are often described screaming and howling and making all kinds of feeling all kinds of intense feelings and physical feelings, not just emotions, but physical feelings. I know some guys will wear diapers just so they don't have to be interrupted
Yep.
with by using the bathroom or
Accident.
wetting,
Yep.
having an accident. Yep. And then the next day is kind of a recovery day.
Got it.
Just a quiet day, and then the next night is the 5-MeO-DMT, which produces a very short journey of about 45 minutes. So it's a very different kind of experience. And 5-MeO-DMT is described as the God particle because many
Okay.
people who have a DMT journey describe meeting some kind of higher power, feeling connected to the universe, and come out of it with a sense of calm and peace and a sense that they've seen something out there that they never fully understood or knew existed.
Interesting. Wow.
Now, I often get asked, have I done these journeys? I never have. Everything I know experientially about them is only from hearing and talking with veterans who have done
Right.
them
Because you
or
didn't need
people
them.
who've gone
So,
through.
right. Right.
Um, I hear the same kind of anecdotes over and over again. And guys I know really well who have had these treatments, I can see the difference in them. I can see the benefits. And not just for the week after or the 6 months after. Um, probably the most vivid example I could give is a friend of mine who he and his family came and spent Christmas week with me in 2019.
Okay.
And he'd done this program about a week before. So he was fresh off the experience and he was telling me all about it. This was a former Navy SEAL, retired Navy SEAL. And before he did this, I don't think he could have gone on and completed a doctoral degree. That kind
Okay.
of educational experience, I think, would have been
Too much
very
for him.
difficult,
Right.
too much for him with his cognitive impairments. But
Wow.
after he did this treatment, he applied to doctoral programs and he recently completed a doctorate in organizational leadership.
Wow. That's amazing.
Yeah,
Did
really
you
cool
talk about
stuff.
stem cells?
Mentioned them briefly in the functional medicine category.
Okay. Yeah, that's what I
And
thought.
that's so there's
The,
not a whole lot I
the,
can say about
the
stem
reason I
cells.
asked, I had another Navy SEAL on, and I asked him because he did both, and I go, which one was better? And he said stem cells. And then I had another Navy SEAL on. He did pretty much everything that you mentioned, and he goes, Dave, it's not all one fix, but try the ones you can, and I think he does pretty well financially, so he had the option of doing what he needed to do. But like you said, like with the God particle, he goes, faith is really important as well, right? That's part of
Hmm.
the balance.
Hmm.
So he goes,
Hmm.
you do all those, but eventually, if you could bring faith out as well, and make a connection with that it's kind of like you're not. It's kind of like you're not here. You're more connected with God, which is pretty cool. So,
Yeah, yeah. And there's other ways to get there. It's not psychedelics aren't the only way to get there.
right.
Part of the reason I saved psychedelics for last is A, I thought it would be the one thing we might end up talking the most about, but also it's the thing I would put at the bottom of this list. Not as in the bottom of the list as in it's the least effective, but one of the last things I would focus on.
Okay.
So when I coach guys, I kind of have a sort of a sequence of things, and this is going to be generic, what I'm about to lay out. So it might not pertain to every individual, but more often than not, this is a sequence that seems to be a pretty good sequence. So start by asking for a sleep study and a hormone panel. And
Okay.
then whatever those results show, those are targets to treat, to address.
VA or no? VA doesn't not do that.
VA is going to is the VA will probably give you a sleep study.
Okay.
They're going to fight you on the hormone
Okay.
panel.
So you may have to do that on your
Neither,
own. Okay.
well, maybe
Okay.
neither DOD nor VA medicine or civilian medicine are eager to test men for hormones.
Got it.
They're not eager to test females for hormones. And and it is complicated. I'm not going to say it's just a simple blood test and then you're off to the races. Usually you want to do a couple of measures, maybe three measures if there's reason to be concerned. But that's usually where I start. From there, and that combined with the lifestyle adaptations, the habits that we talked about, sleep and anti-inflammatory. From there, then I go to stellate ganglion and ketamine.
Okay.
I think those are pretty safe, pretty reliable interventions for almost everybody. After that, then it becomes more tailored to the individual. I think after that, I would look at functional medicine approaches. I would probably take 3 to 6 months off of any intervention after the stellate ganglion and the ketamine. Just let those sink in.
Right. See how you
See how
feel.
far that takes you. Yeah,
Right.
see how far that takes you. Maybe that's a good time to start talking to a therapist. Maybe that's a good time to start journaling, and meditating, those kinds of things. Breath work,
Right.
is very powerful. Um, then I would start looking at some of these other interventions. The psychedelic interventions, I usually prefer to save after some of these other things have been tried. better to go to a psychedelic retreat when you're already in a fairly stable place rather than when you're at your most acute. I mean, if somebody for somebody who's suicidal, I don't recommend psychedelics
Okay,
at
gotcha.
that point.
All right.
Um,
And
I
some of
would
these
encourage other
therapies,
things.
you may not need them all, right? You could just maybe do one or two, like you were mentioning,
Correct.
right?
Correct.
And if you're
Not
feeling
everybody.
better,
Right.
you may have found a solution on top of eating healthy and exercising
Yeah.
and
Right.
making that whole combination and sleeping right.
Yeah.
Okay.
Yeah. You improve your sleep, you improve your hormonal functioning, you're going to be a different person right off the bat.
So
It doesn't mean there's
sleep might be an easy one to start with right away.
not necessarily easy to sleep
Yeah,
better,
yeah,
but
yeah.
it is a great
You can
place to
try. You can
start.
try it right away. Right.
Yeah, you can start working on it right away.
Right.
Here's a tip that I often here's sort of a strategy because doctors and medicine are very conservative. VA has what it has to offer, and it's not necessarily going to get very creative or willing to provide some of these interventions. What does seem to work is I encourage people to find the medical paper that we published in 2020. So we published a medical paper in the
Okay.
medical literature titled Operator Syndrome. If you Google operator syndrome medical paper, if you put that into any search index, it's going to come up. You'll find it very easily. You can print that off. You'll get a PDF, print that off, and go through it with a highlighter. The paper itself is a descriptive paper. It's not a hard read. It's not a lot of medical jargon in there, and it's descriptive of what we've been talking about. Um, what I've seen is guys that will read the paper and then go through it with a highlighter, circle the things that make sense to them, take that to their doctors, take that to their providers, and show it to them and
Right.
educate them and say, listen, I'm a former cop or I'm a current cop. I'm a soldier. I did 2 tours in Fallujah as a Marine. I served in naval special warfare. Whatever. Take that paper to them, explain how you fit the model, and then show them the paper. And it seems like with that, they're much more likely to go, okay, I get it. Now I will refer you for a sleep study. Now I will refer you to receive a hormone panel. Um, and so I've seen a lot of guys over and over again over the years find that strategy works pretty well.
That's
And
awesome.
yes, the Operator Syndrome book, which was published last year,
Okay.
has a lot of information about kind of walking, not only explaining the syndrome, but walking you through the steps to find the healing. Um, and one other piece I would say with that, Dave, is if you're married, if you have a significant relationship, include your spouse
Oh, there you go. Yeah.
in this.
They're gonna see things that you're not seeing.
And they're suffering anyway.
Right. That's true. Yeah. They going
They
through it as
see
well. Yeah.
they see it, they're going through it anyway. Educate them. It will give them a little understanding and appreciation, and then they can be your ally in your wellness journey.
Wow, this is incredible information, Chris. I love it. One thing I wanted to ask you, a lot of people, a lot of operators or first responders, like, man, I'm different. Out of all these years talking to all these people, are we really that different?
Yeah. I'm going to read you a quote from my
Okay,
book.
all
So
right,
one of the things in my book, one of the things that I did with this book is I collected quotes.
okay.
I probably got 40 plus operators quoted in the book.
Oh, wow.
I've probably got a dozen spouses of operators quoted in the book, and then I've got some medical professionals quoted. So I'm going to read you one quote that's at the very top of chapter 1,
Okay,
and this quote is from a man named Clay Jensen, who retired as a master sergeant in the Army.
okay,
He served with 7th Special Forces Group, and he was an OGA contractor, a CIA contractor.
yep,
And here's his quote. Every time I see a new primary doctor, VA or civilian, they are completely overwhelmed by the sheer number and severity of the different medical issues I have. Nobody knows how to treat me. I'm completely different from any other patient they've had. For over 10 years, I struggled to understand why I am the way I am and to know what was really wrong with me. Then I came across an article on operator syndrome and was like, holy shit, I'm normal. I went from
Yes.
feeling totally alone to being part of the tribe again.
I love that, and thank you. That's exactly what I was looking for. So, and this wasn't set up, guys. But I mean, it's we all think we're on an island by ourselves. We're stuck, but there's so much help and resources out there, especially nowadays, right? That you could actually find something to help you be better, right? It's just something daily that we could be doing. So, thank you for that.
When when I give workshops or talks, and in the last, I'm just going to go back the last few talks, I've given talks to a group of active duty EOD technicians at Joint Base Pearl Hickam. Recently gave a talk to Southern California DEA headquarters, which
Okay.
included a lot of FBI agents there. 19th Group, Special Forces Group out in Utah, a room full of state police, including DEA and SWAT out in Arkansas a couple months ago. Even on my own home island, local police and firefighters. What I get everywhere I present, what we've been talking about here today, and these are usually 3 to 4 hour workshops, but during the breaks and afterwards, guys come up to me and they go, "Wow, never heard of this stuff, but I check every box. Everything you described, it's like you're describing me and my
Right.
life and the difficulties I have." Um, the good news is, I think there are now a lot of different forces, a lot of different individuals, different groups that are trying to bring this operator syndrome framework forward, get it adopted into the VA, get it part of DoD doctrine, bring it to first responders. And part of the perspective of this, and I think I think I've implied this, but maybe I haven't said it.
Okay.
It's physiology first. It's
Yep.
physiology
Right.
forward.
Yep.
All of the human physiological systems in our body become involved, and they're all interconnected, right? Our
Yes.
brain affects our gut affects our brain, affects our sleep, etc. And so they're all interrelated. You injure one part of the body, it's going to have effects on the other parts. We have vectors here that are affecting all of these systems. So it becomes a very complicated set of interrelated injuries. And that's why I think modern medicine has really struggled to
Right.
identify and intervene
Exactly.
appropriately.
Yeah, they have the they're stuck in a box as well,
Yeah.
unfortunately. Uh, we're talking to all these. Actually, before I get into that, a lot of these therapies. Let's say you're active duty or currently on, a police department or firefighter. Can you use these therapies, or are they frowned upon, or are they considered drugs, or what's the case for that?
You absolutely can receive all of these therapies except the psychedelics,
Psychedelics.
which are not legal, the ones that are not legal in the U.S.
Okay, got it.
Um,
Okay.
I'll even give you an example. Sean Mulvaney and Jim Lynch, Dr. Lynch, who were two of the pioneers of the stellate ganglion block therapy at Fort Bragg, once they became confident in the benefits of their interventions, they started traveling around the US and treating a lot of the special operation groups
Oh wow. Okay.
with stellate ganglion blocks
Oh wow.
during their active service
Oh,
with
that's
the
right. You said they were
idea.
at Fort Bragg, right? Doing it.
Yeah, they
Yeah.
were they were at USASOC, and the idea of, hey, we're going to help you not just feel better, but function better. You're going to perform better after we give you this treatment. You're going to sleep better. You're going to have better cognitive functioning, which is very, very important, obviously, for what they do.
Are they still practicing then?
Yeah, I think they're not in the Army anymore. Sean, a really interesting guy. Sean Mulvaney was a Navy SEAL
Okay.
before he went to
I've
in the
heard of them.
90s. In the
Yeah.
90s, before he went to medical school.
Okay.
So he was a SEAL, then medical school, then neurologist, then back to the Army. He's in private practice in the Annapolis area. So yeah, you could go get your treatment from Dr. Mulvaney in the
That's what I was
Annapolis area.
wondering.
And
Yeah.
I think Dr. Lynch is in the Annapolis area too. I think they're both in private
Okay.
practice there.
Perfect. Perfect. What was the most valuable lesson that you learned while helping all these people struggling?
Could you be a little more specific? Lesson for myself,
Yes.
lesson for
Yes.
helping
Like
others.
like overall, yeah, for yourself.
For myself, Well, I would say the last 12 years, um, which f my journey happened organically. It wasn't a plan. I didn't set out to do something. I helped a few people because they were there and they were my friends. Then I helped some more guys, became friends with them. Um, it's been the most incredible 12 years of my life. The privilege and the honor I have received to be able to work with the community of men and women who protect the rest of us has been humbling. I feel like I'm a much better person for it. My own character, my own life, my own resilience, just from seeing and being around our warrior protectors has really uplifted and enhanced my life.
That's
Um,
incredible. Yeah, you're definitely changing people's lives. So yeah, it's that's huge, Chris. Thank you so much for doing that. I appreciate that. I was going to ask you about here. Now we'll skip that one.
hmm.
We covered a lot of stuff. A lot of my questions I have, so I'm skipping a lot of these. So bear with me one
That's
second.
all good. It's all good. One of the things I've experienced, and again, I've not been functioning in any kind of formal capacity for the most part. And I do a lot of things with this group. I mean, I have friends and families, and I literally consider them many of the people I've worked with to be families. I stay with them when I'm in Annapolis. I stay with the Luna family. When I'm in San
Oh,
Diego, I
wow.
stay with the Aconiac family.
Okay.
I've been to milestone birthday parties, retirement ceremonies, funeral. I've done some contract work with the community. I won't really speak to that, but I've done some work that involved some training activities, working with operators who were being trained. I've been in, close quarter combat kinds of things.
Nice.
I also spent 3 years working with an enterprise over the last few years, set up to bring our Afghan allies out of Afghanistan since 2021. Um, we've been, this all got halted in January, but up till January, this enterprise brought out 60,000 men and women from Afghanistan
Wow. Holy.
since 2021. So these were the soldiers, the interpreters who embedded with our troops and their families. So children and parents and spouses. And I've worked with the team that did this, but I've also, I've been up close and personal on a flight and seen the people themselves, coming onto the airplane and disembarking from the airplane on literally a freedom flight.
What an experience. Incredible. How can listeners, especially civilians, kind of full circle back when we started better support veterans and warriors in the community?
Really good question. And not a simple answer, but I think one answer is learning,
Yes.
getting educated,
Read the book,
understand
get the
what
paper. Yeah.
those kinds of things, but also learn about the global war on terror. Because
Right.
our media is not really educated Americans
What's
on the
really happening?
wars and
Right.
what's really happening, and especially on how much our special operations forces have been used during the war. This was a special operations war, heavily. I'm not taking away anything from conventional forces, and certainly conventional forces played a very important role. But learn about the war, learn what happened, learn what our forces saw and experienced in Afghanistan and in Iraq and in other parts of the world. And then I would say, if you want to get involved, there's ways to do that. Look for a foundation, donate to some of the foundations, volunteer for some of the foundations. Those would be things that one can do. I think, coming in the near future, there are going to be things that are happening at the policy level to make changes for the way DoD and VA medicine works. So maybe it's get attuned to those and join in and write letters to your congressman about making changes to healthcare for soldiers and for first responders.
That's great advice. Thank you. How can people connect with you, Chris? Are you on social media? website? What's your website?
I do have a website,
Okay.
chrisfree.com. It's very simple.
Okay.
The book is on Amazon, or you can buy it directly from the publisher, Ballast Books. If you want to buy multiple copies, I would say go to the publisher because they'll give discounts for if you want to get more than 10 or more copies.
Okay.
You can go direct to the publisher, again, Ballast Books. The medical paper is up for free. You also could go to Havoc Journal, which is an online magazine, free online magazine for veterans and first responders. And I've published a series of essays there over the last 3 months related to operator syndrome, related to the existential issues. And those would be quick ways of learning. So there's a 4-part series of essays on operator syndrome. And again, that's Havoc Journal.
Awesome. Awesome. One last question. We'll start wrapping up. If you could deliver one message to every operator, veteran, and family member out there who's quietly struggling, what would you say to them right now?
That's almost easy. I would encourage them to understand that much of what they may believe
Hmm.
about their struggles, especially that it's primarily PTSD, I would say try to understand it may not be that simple, that it may be as complicated as all the physiological things we've been talking about, and that in understanding that, have hope. Have hope because once you understand the physiological nature, once you understand the operator syndrome framework, you will begin to recognize the solutions and the things that can be absolute game changers for your life. That you can live a happy, high functioning, healthy life.
Awesome. Love it. Yeah, I think this has been a great podcast. A lot of different information and very informative to be able to help you, right? So make sure you guys share the podcast as well. Uh, Chris, thank you for your honesty, your insight, and unwavering commitment to those who serve. Your work is making a real difference, and was an honor to have you on the show today.
Thank you, Dave. It's great to be here.
Thank you. For our audience tuning in, share, follow, and subscribe. These stories need to be heard. These lessons can change lives. Stay focused, stay winning. God bless you. And thank you for listening and following.